Now, the World Health Organization has warned that repeating booster doses of the original COVID vaccines is not a viable strategy to combat the emerging variants. The body has called for new, specific jabs that can better protect against transmission. This is according to an expert group that is created by the WHO. It says, and I'm quoting here, a vaccination strategy based on repeated booster doses of the original vaccine composition is unlikely to be appropriate or sustainable. The group says there could be a need to update the existing vaccines. It says that development of the new jabs would not only protect COVID patients from falling seriously ill, but also prevent people from catching the virus in the first place. New vaccines could also help lower community transmission and prevent severe disease and even death. The expert group calls for vaccine developers to create jabs that elicit immune responses that are broad, strong and long-lasting. According to the World Health Organization, 331 candidate vaccines are currently being worked on around the world.
There are two concerns here, is that if we have a strategy in which we give boosters, let's say, every 4 months approximately, we will end up potentially having problem with the immune response, and the immune response may end up not being as good as we would like it to be. So we should be careful in not overloading the immune system with repeated immunization. And secondly, of course, there is the risk of fatiguing the population with the continuous administration of boosters.
Meanwhile, the UN Health Agency has not been pushing booster blanket programs worldwide. The body says that this is not an efficient strategy, as many people in poorer nations are still waiting for their first jab. So far, over 67% of people in high-income countries have received at least one jab. Less than 11% have been jabbed in low-income countries. WION is now available in your country. Download the app now. Get all the news on the move.